Hi, my name's Graham Nelson. I'm from Northwest Physiotherapy Group, and welcome to the Physio Files. Today we're talking about Achilles tendonitis or tendinopathy, which is number 4 in our series, Top 5 Causes of Leg Pain. Russell Visser is going to talk to you today about Achilles tendinopathy, and I'll leave it to Russell.
Thanks, Graham. Achilles tendonitis. Initially, it's an inflammatory response of the Achilles tendon and the tendon sheath caused by overuse or excessive activity, and later, if the problem persists, it can actually become more of a wear and tear chronic degenerative problem called Achilles tendinopathy, which has got far more serious consequences and needs much more careful attention.
So Russell, how do you know you've got Achilles tendonitis or tendinopathy?
Thanks, Graham. It's fairly obvious when you do have Achilles tendonitis because the pain is usually felt in the region of the Achilles tendon. So the Achilles tendon is at the back of the leg here, inserting into the heel bone. And what you'll feel is pain felt along the Achilles tendon, usually in the early stages involving the sheath of the tendon, which may be brought on by activities such as running or playing sport. What generally happens is that the tendon will become sore and it may stop you from playing sport, and plus it'll give you some pain after you stop, or with activities such as going up and down stairs. The other thing that stands out with Achilles tendonitis typically is that when you change position, when you get out of bed first thing in the morning or move from a seated to standing position, you'll get a sharp pain for the first few steps, and generally it settles down. Now this again can become more pronounced and more severe as time goes on and it's not addressed appropriately.
So Russell, what are the causes of Achilles tendonitis?
Thanks, Graham. Now, Achilles tendonitis initially is caused by overloading of the tendon. So that can come about by an increase in training load, such as more uphill work, more speed work, or more sharp interval type work at training. Also, it can happen from a change in biomechanics, so the loading up from poor foot biomechanics. And also, we often see it clinically from people who've got unresolved past injuries. So if you've injured your calf in the past and it hasn't been properly rehabilitated, you may develop scar tissue, the muscle may develop weakness, so it doesn't actually cope with the load, or you might get some inhibition during the activity, which then places more stress on the Achilles tendon and irritates it and sets up this inflammatory response, which is pain, swelling, tightness that we experience as Achilles tendonitis.
So Russell, how can we manage this problem if it starts?
What you need to do initially is just assess your training workload. You need to back off from the speed work, the heavier sort of jumping and ballistic work, and also just maybe rest off that running activity, which is often the cause. So you may spend some time in the pool, or you might do some bike work, just to give the Achilles time to settle down before you gradually resume training again. The other things you need to do are to manage it with your ice as well after training, and do the stretches. Graham explained the calf and soleus stretches, the Achilles stretches, in the last talk on shin soreness, so have a look at those and see what you can do in terms of managing it that way. If the symptoms persist in spite of all those initiatives, you may need to make an appointment and come in and see us, where we've got our specialised examinations tool, the gait scan, to assess abnormal lower limb and foot biomechanics. So call us, get in, and we can have a look at that. We can also assess lower limb biomechanics generally to see if that's contributing to your Achilles problem, and prevent it from becoming a more pronounced and chronic issue which will affect your training and performance in the long term. Thank you.